I would like to kind of do a little bit into that. How do you integrate your knowledge, and especially in agile methodologies, just such as Scrum, into the development process of medical devices that you do all the time? And what advantages does the knowledge bring to you?
Yeah, that's very interesting question and one of my favorite as well because topic agile is one of my favorite topics. Um, Theoretically or if you think more from the theoretical perspective and go back to in the 90s, especially in 1997, FDA had actually a publication on the medical device design controls.
Wow.
And everyone who is new to the industry, he get a flavor of design controls, a so-called V model. That if
Okay.
you have on one side of the V, you have the design inputs on the other side of the verification and validation of the design inputs, a so-called V model, which is actually very primitive waterfall model based on a waterfall model uh,
Okay.
of development. Um, Still, it is being taught if you start a new job in a medical device. You don't learn it normally in the university, but once you get into medtech, you learn
Hmm.
it. We have a V model. We have to define the user requirements or customer requirements. From there, you have system requirements and goes to further deep in the unit or the subsystem requirements. And
Hmm.
on the other side of the V, you have to verify all those requirements. And at the end of the day, you have to validate it in a
Hmm.
more user environment. Like if it's um, I would say extra equipment, for example.
Okay, like a pilot or a prototype stage.
You
Yeah,
verify
okay.
everything, all the
Hmm.
requirements are met, but then you have to take this to in the field and the healthcare professional has to test it and then you
Hmm.
validate it. It's sort of like human factory studies. It's also
Okay.
mainly, yeah. So I'm not sure if how regulated is the automotive that you have to do human factors, but for medical device is a must. There is a standard for it, 62366. Only
Wow.
for human factors studies in the medtech. So
Hmm.
I mean, it's very regulated. So you have a
Yeah.
dedicated risk management standard for
Hmm.
medical risk management. You have a dedicated
Hmm.
standard for usability in the medtech. I
Yeah.
mean, everything is very, very much specific to it.
Yeah.
Fortunately, the thing has changed a lot since we had this design control guidance from the FDA in
Okay.
1991. Everybody has adapted it. It is well accepted in the industry if it's US or it's EU. But as we progressed in the Scrum or the Agile world,
Hmm.
there are some ways where we can implement. Not 100%. Actually, you cannot implement the way you implement in an industry is the agile methodology. You need to be somewhere in between the classical model
Hmm.
um, model or and the classical agile model somewhere in
Right.
the between. You can still there is a guidance a TIR 45
Okay.
for agile medical device software
Okay.
dedicated to
Hmm.
also ISO guidance dedicated for medical device software
Okay.
or medical software. Um, the the catch here is that you cannot completely develop your device agile, but you can still take out some feature set.
Okay.
You can split your medical device. Let's suppose you have a X-ray machine. You can divide it into subsystems.
Okay.
There is a branch of engineering called system engineering where
Yep.
you can define your device as a complete system
Yep.
and use and set subsystems.
Yep.
They have interfaces. Once you have it, it's easy to break down into subsystems, and each systems have some set of features. You can develop these features independently of the other features
Hmm.
and test it in this agile cycle
Okay.
verify and validate it. Actually, for every agile cycle, you have to do this V model for every agile cycle.
Wow.
It's more burden, but it has the benefit that it gives you continuous quality oversight. You can
Okay.
say, okay, this feature is developed, it is tested also.